friends, coronary artery calcification is basically a degenerative process in which calcium gets deposited inside the coronary vessels, which leads to premature degeneration of the vessels, leads to high risk of complication during angioplasty and unnecessary referral for the patient for bypass surgeries. Today we'll be discussing whether any medicines are available for this management and how effective are these medicines in preventing coronary artery calcification, because this is one of the very important concerns which a lot of people ask us to. Today we'll be discussing what are the various medicines which are available for coronary artery calcification. Before we go into the topic, I would request the people who are new to my channel to like the videos, comment on the videos and to share the videos in social media groups if possible. So without wasting any time, let's dive into the topic. The single most important medicine which is available for reducing a coronary artery calcification is vitamin K2 supplements. This usually helps in metabolism of the bones, and this usually helps in proper management of the blood calcium, extra calcium which is present inside the blood, that is appropriately managed, and the deposition of the calcium inside the coronary vessels or in any other vessel of the body will be reduced. This usually helps in reducing your coronary artery calcification by promoting proper calcium metabolism and preventing the calcification of soft tissues which usually occur in these patients. So vitamin K2 agonists usually can be taken as medicine in these patients, although this is not very effective and all cases of coronary artery calcification will not be prevented by this. But this is perhaps the only few medicines which are available, and to a certain extent this will be helpful. Besides this, medicine like bisphosphonates, which includes alendronate, risedronate and zoledronic acids, which are used to basically treat osteoporosis, they have potential benefits in reducing coronary artery calcification. They have been studied in coronary artery calcification and they inhibit the resorption of the bones. Although the exact role in coronary artery calcification and how exactly effective they are in reduction of vascular calcification, that has not been proved so far, but this is one of the other medicines which is available to reduce coronary calcification. Besides this, the other medicines for atherosclerosis can be effective in this regard. For example, the cholesterol reducing medicine like statins, atorvastatin, rosuvastatin, simvastatin, pravastatin, lovastatin, whatever statin you take, they reduce the cholesterol level, the bad cholesterol level, and prevent the plaque formation inside the coronary arteries. They have anti-inflammatory effects which stabilize the pre-existing plaque, reduce the risk of rupture and reduce the occurrence of heart attack. So by improving your lipid profiles with the use of statins, you can also reduce the risk of coronary artery calcification. Blood thinning medicines like aspirin will help in reducing the chances of heart attack and plaque rupture in these patients. This has some anti-inflammatory effects also and will also reduce the chance of platelet aggregation and formation of blood clots. So in patients having coronary artery calcification, we should take some blood thinners like aspirin or clopidogrel. Although this will not completely prevent coronary artery calcification process, but it will reduce the chance of having heart attacks and other vascular complications which are much more common in these patients. Besides these, medicines like ACE inhibitors, which include lisinopril, enalapril, captopril, pridinopril, this also reduces the blood pressure. This also helps in dilation of the blood vessels. This also helps in further vascular damage, and they also help in reducing the endothelial dysfunction, which is an important risk factor for the occurrence of calcification. So that is also reduced by this medicine. So in comparison to the other antihypertensive molecule, this can be used as a first choice molecule if at all a patient is having a high risk of coronary artery calcification. Similarly, ARB or angiotensin 2 receptor blockers like losartan, valsartan, candesartan, these are the predominant sartans which have a blood vessel relaxing property and they act in similar fashion as compared to ACE inhibitors. They also can help in preventing coronary artery calcification, although their efficacy in this regard is much lesser studied. But still, all sartans do not behave in the same way. That is why we tend to recommend ACE inhibitors as the first line of medicines. The other sartans like losartan, valsartan, candesartan can be preferred in comparison to ACE inhibitors when the patient is having some systemic side effects related to ACE inhibitors like dry cough or angioedema. Then we can prefer the ARBs, but usually ACE inhibitors are usually taken as the first choice medicine. Then cholesterol reducing medicine like PCSK9 inhibitors like alirocumab and evolucumab can be taken in patients where the cholesterol values are not adequately being controlled, in patients with very high levels of LDL values, especially when the patient is having familial hypercholesterolemia or patients who are not being able to tolerate statins. In these patients, PCSK9 inhibitors can prevent the plaque buildup and help in slowing the progression of coronary artery disease. Patients having high amount of triglyceride can prefer fibrates like gemfibrozil and fenofibrate. These drugs have a beneficial effect in reducing your triglyceride level and improving your good cholesterol or HDL levels. These medicines can be used in patients having metabolic syndrome and in patients having high amount of triglyceride levels. This also helps in reducing the inflammation and improving the atherosclerosis and coronary artery calcification. Medicines like calcium channel blockers like amlodipine, diltiazem and verapamil, they help in relaxing of your blood vessels, decreasing the cardiac workload, and they also help in reducing hypertension, angina. They improve the vascular health, but the effect on coronary artery calcification is not very clear, although they might be helpful in reducing your blood pressure and stabilizing your cardiac stress. Then, if at all the patient is not still having any good control of cholesterol values, you can add ezetimibe to the combination. Ezetimibe also reduces the absorption of LDL cholesterol in the intestine, which reduces the amount of cholesterol which reaches the liver. Therefore, significantly lower amount of LDL cholesterol can be obtained by these medicines. Besides this, you can try a diet containing fruits and vegetables, whole grains, lean proteins and healthy fats, regular exercise, weight control, smoking and alcohol reduction, and control of mental stress. These are all the lifestyle modifications which will be helpful in this regard. Finally, we have to conclude that basically only vitamin K antagonists and bisphosphonates are the only drug which can directly influence the calcium metabolism. The other drugs which reduce atherosclerosis, which decrease the LDL cholesterol levels and which decrease the inflammation, can be helpful in reducing coronary calcification to some extent. But none of these medicines are absolutely very effective and will be able to completely prevent the vascular calcification. But vitamin K2 agonists are the most important drugs which are tried in this regards. Bisphosphonates are also being tried, but research is limited in this field. So as of now, not many medicines are available and not very effective medicines are available in this regard. So dietary modification along with the use of these medicines may help you to a certain extent, but complete prevention of vascular calcification might not be possible with the available medicines as of now. So in this topic, we have discussed what are the various medicines which are available to reduce the chances of coronary artery calcification. Before we end the topic, I would request you, the people who are new to my channel, to subscribe to my channel, like the videos, comment on the videos, and to share the videos in social media groups if possible.